Before you sit down to enjoy your breakfast tomorrow morning, take a moment to understand something that could have a major impact on your health. Many people believe that strokes happen suddenly and without warning, but medical research shows that the body often enters its most vulnerable state during the first few hours after waking. The choices you make during this short period can influence your cardiovascular health more than you may realize. For adults over the age of 60, the early morning hours deserve special attention. Certain everyday habits that seem completely harmless may quietly increase the likelihood of experiencing a stroke or other cardiovascular complications. Surprisingly, the greatest risk window is not during physical exertion or moments of emotional stress later in the day. Instead, it begins shortly after you open your eyes. Studies have shown that stroke risk rises significantly within the first 2 hours after waking. During this time, your body's internal systems are transitioning from rest to activity, creating physiological changes that deserve careful consideration. Some morning routines that people have followed for decades may unintentionally place additional strain on the heart and blood vessels. In this guide from Longevix Hub, you'll discover 7 common morning habits that may increase stroke risk and learn practical adjustments that can support healthier mornings and better long-term well-being. The first habit begins before your feet even touch the floor. Most people wake up and immediately jump out of bed without realizing that their body is still adjusting after several hours of rest. During sleep, important changes occur within your cardiovascular system, and those changes don't instantly return to daytime levels the moment you open your eyes. While you're sleeping, your blood pressure naturally drops to its lowest point of the day. As soon as you wake up, however, your body releases hormones such as cortisol and adrenaline that help prepare you for daily activity. This causes blood pressure and heart rate to rise rapidly, creating what many healthcare professionals refer to as the morning blood pressure surge. For older adults, particularly those over 60, or individuals managing hypertension, this transition period deserves extra attention. Standing up too quickly can temporarily challenge your body's ability to maintain stable circulation. Blood may briefly pool in the lower parts of the body, forcing the heart to work harder while blood vessels are still adapting to the sudden change in posture. A simple adjustment can make a meaningful difference. Before getting out of bed, sit upright for about 30 to 60 seconds. Allow your circulation to gradually adjust before standing. This small habit takes less. The foods we eat first thing in the morning can have a greater impact on our cardiovascular health than many people realize. While breakfast is often promoted as the most important meal of the day, it's equally important to pay attention to what actually makes up that meal. Many products marketed as nutritious and heart-friendly may contain hidden amounts of sodium that quietly contribute to elevated blood pressure over time. A typical breakfast consisting of whole grain bread, processed turkey slices, flavored instant oatmeal, or other packaged convenience foods can easily provide more sodium than expected. Even foods labeled as low-fat, whole grain, or healthy choice may contain significant amounts of salt to enhance flavor and preserve freshness. When several of these items are combined, sodium intake can quickly add up before the day has truly begun. For individuals over the age of 60, especially those managing hypertension or cardiovascular concerns, excessive sodium intake deserves careful attention. Elevated blood pressure remains one of the most significant modifiable risk factors associated with stroke. Since blood pressure naturally rises during the early morning hours, consuming a high-sodium breakfast may contribute additional strain during a time when the body is already adjusting to the transition from sleep to activity. This doesn't mean you must completely eliminate sodium from your diet. Rather, becoming more aware of nutritional labels can empower you to make better choices. Compare the sodium content of your favorite breakfast foods and look for lower sodium alternatives whenever possible. Small dietary adjustments made consistently can produce meaningful long-term benefits. Another common morning habit involves managing aches and pains. Many adults experience stiffness or discomfort when they wake up, particularly in the joints or muscles. As a result, reaching for over-the-counter pain relievers has become part of many people's daily routines. While these medications can provide effective pain relief, it's worth understanding how certain options may influence blood pressure and cardiovascular health. Taking time to discuss long-term pain management strategies with your healthcare provider can help ensure that your approach supports both comfort and overall well-being. Even seemingly minor daily habits deserve thoughtful consideration when it comes to protecting your health. Many people begin their mornings by reaching for a pain reliever before they've even had breakfast or a glass of water. Joint stiffness, back discomfort, and muscle aches become increasingly common as we age, making this habit understandable and incredibly widespread. However, when certain medications become part of a daily morning routine, it's important to understand how they may affect more than just pain management. Some commonly used nonsteroidal anti-inflammatory drugs, often referred to as NSAIDs, can influence how the body handles sodium and fluids. In certain individuals, these medications may contribute to fluid retention and can potentially affect blood pressure levels when used regularly. For older adults already managing hypertension or cardiovascular concerns, this is an important consideration that's sometimes overlooked. Long-term use of over-the-counter medications may have effects that develop gradually over time, rather than producing immediate symptoms. Because of this, many people may not recognize that a daily medication habit could be contributing to changes in their overall cardiovascular health. If you're taking pain relievers regularly each morning, it may be beneficial to discuss your medication routine with your healthcare provider. Depending on your medical history and individual needs, there may be alternative approaches that are better suited for long-term use. Some individuals may benefit from different medications, physical therapy strategies, lifestyle modifications, or other pain management options that support both comfort and cardiovascular well-being. Perhaps even more importantly, paying attention to how your body feels when you wake up each day can provide valuable information. Certain symptoms that seem